Hello friends, this is Dr. Anshika. You also know me as Dr. with CMN. So, like in the previous video where I've explained about congenital melanocytic nevi, that is CMN, and Sturge-Weber syndrome, this video is about explaining a type of nevi that is known as Beckers nevus. That what it is, how is it caused, can it be treated or not, is it communicable or not. So I'll try to explain as much as possible about it. So let's start. Beckers nevus. What it is? Beckers nevus is a late onset epidermal nevi or birthmark that is characterized by presence of a light brown patch. As you can see in the picture, there is a presence of a light brown patch and there is an excess hair growth on it. Now we'll talk about its prevalence. So it is a late onset nevi that occurs at the age of 17 to 26 years of age, most probably. It can occur in later stages too, but it usually occurs at the age of 17 to 26 years, and it has a prevalence of about 0.52%. Also, if we talk about its occurrence, it is more common in males. It is more common in males because of presence of a male sex hormone known as androgen, which triggers its growth. Now we'll talk about its cause, that how is it caused. So exact etiology about is unknown. We don't know how is it caused exactly, but it is thought like CMN that is caused by a mutation of an NRAS gene. It also might be caused by a mutation or defect of a gene which we still don't know the specific gene. Development is also triggered by circulating androgen. Thus, it is more common in males. Now, if we talk about its appearance, that how does it look? So, as you can see in the picture, you guys just see the picture that I've put it in. It usually occurs unilaterally on one side of the body and on the shoulder or upper trunk. And if it is a female, it can also occur in the breast region. And there is the presence of excess growth, hair growth on it, and hyperpigmentation. As you can see in the picture, there is a light brown patch which differs from the skin due to the presence of melanocytes that makes it hyperpigmented. And skin can slightly be thickened too. If there is a presence of excess cell growth, there can be thickening of the skin too. Also, also Becker's nevi is not a genetic disorder. It does not run in families. Now we'll talk about its diagnosis. How can we diagnose it? So it can be diagnosed on the basis of clinical diagnosis. We should go to a doctor and get it checked to differentiate it from other type of nevi, and biopsy can also be done, and biopsy is done to differentiate it from a type of nevi known as cafe or loss nevi. Now, if we talk about the treatment, there is no effective treatment for it, but laser therapies can be done. We only can manage it. So, for management, we should keep out of the sun because direct sunlight having UV rays, that is ultraviolet rays, can cause irritation to it, and due to presence of excess hair, we can also opt for hair removal. Now we'll talk about its prevention. So there is no preventive strategy currently. We only can manage it by keeping out of sun, removing hairs. So thank you. And if you've liked the video, do like, share, subscribe. And if there is any query, do comment. Thank you.